The learning objectives of the biomedical module are the following. Provide a broad overview of Alzheimer's disease and related dementias in the United States. Explain biological theories and underpinnings of ADRD. Describe the stages of progression of ADRD. And analyze current and future treatments for ADRD. For an overview, dementia is an umbrella term that encapsulates Alzheimer's disease, among others. Dementia describes this collection of brain diseases and their symptoms, including memory loss, impaired judgment, personality changes, and an inability to perform daily activities. Alzheimer's disease is the most prevalent form of dementia, accounting for approximately 60 to 70% of dementia cases. In the United States, 6.7 million older adults have known Alzheimer's disease cases, particularly afflicting adults in their mid-60s or later. Furthermore, the risk of Alzheimer's disease is higher for women than for men at ages 45 and 65. There is the explanation that women live longer than men to account for the disproportionate impact of Alzheimer's on women, but scientists are exploring this imbalance further, looking at biology and sociocultural impacts to understand a broader picture. In the United States, the annual rate of deaths due to Alzheimer's disease has risen substantially since the year 2000. This rate is particularly impacting people ages 85 and older. The long duration of this illness and the burden can feel significant. The disease pathology of Alzheimer's disease is characterized by amyloid plaques and tau tangles. While it is important to note that the exact causes of this disease are not fully understood, scientists understand that at a basic level, brain proteins don't function as usual. Looking at this figure, we'll start with beta amyloids. Beta amyloid is a fragment of a larger protein. When these fragments clump together between neurons, they form larger deposits called amyloid plaques. This is toxic as these plaques disrupt communication between brain cells. There are also tau proteins. In healthy neurons, tau proteins provide structural support and deliver nutrients and essential materials to brain cells. When the tau proteins change shape, however, they twist into what we call tangles inside neurons, which disrupt the transport system. When these disruptions occur, the interplay leads to neuronal loss and neurodegeneration, marking the symptoms we understand, including memory loss and impaired judgment.
Next, we're going to be talking about the early signs of dementia as well as the stages of dementia. These early signs are, but not limited to, some of the quote-unquote daily tasks that people normally do. These can be such as lack of short-term memory, having a lack of short-term memory, trouble keeping track of a purse or wallet, forgetting to pay bills, planning and preparing meals, remembering appointments, or traveling outside the neighborhood. The mild state of dementia is categorized by difficulties that may include issues with planning, organizing, concentrating on tasks, or accomplishing parts of appointment if the individual is still in the workforce. Strategies for assistance, these can be mainly just helping with daily tasks or just remembering certain things. These are patients you most likely will not be dealing with since they are in a memory care facility. However, it is important to keep them in mind. The moderate stage of dementia is brain damage that is extensive enough that a person has mood and behavioral changes such as aggressiveness, depression, paranoia, anger, wandering, and frustration. Some strategies for assistance will be to always remain patient and calm around patients, as well as not addressing or responding to negative remarks. However, if negative remarks remain persistent or are they making you feel uncomfortable, please go to the nearest staff member, and they will help you. The severe stage of Alzheimer's, according to the Alzheimer's Association, is approximately 40% of what their time is spent in 40% of their time spent in the final stage of dementia. This will require extensive assistance with daily living activities such as personal hygiene and eating. At the very end of this stage, the individual will most likely be bedridden. Some strategies for assistance, providing help with performing daily activities, and just doing activities such as reading to them, because a lot of patients will be nonverbal at this stage.
Okay, so moving on to the next section, we're actually going to be talking about some of the FDA-approved drugs and treatments for Alzheimer's disease, especially those targeting the symptoms of Alzheimer's disease. Now, what you really need to gain out of this section as a volunteer is not really the name of the drugs or exactly what they do. It's just sort of an exposure for you guys to know that some of your patients and buddies that you've worked with and volunteer with at those nursing homes and memory care units might be taking these drugs. So to begin off, we're going to be looking at aducanumab and lecanemab. Those are both FDA-approved drugs as of the time of filming this video. These are the only two FDA-approved drugs that are directly targeting Alzheimer's disease. They are mainly drugs that target the beta amyloid aggregation that is very characteristic of Alzheimer's disease. And essentially, they reduce those levels of beta amyloids in the brain, and hence this is shown to reduce the rate of cognitive and functional decline. Moving on to drugs that actually target symptoms rather than the pathology behind the disease itself. The first one is cholinesterase inhibitors. And there are multiple types of cholinesterase inhibitors out there in the market that have been FDA approved and used for Alzheimer's patients, and also glutamate regulators that treat sort of memory, thinking, language, and judgment. And as you can see from the pie chart here, actually, as you can see here, the different drugs that are used to target cognitive symptoms are used in like different percentages of are present, or these drugs are actually used differently. And as you can see in the pie chart here, sometimes you'll have dual therapy, which is having two drugs at the same time to target the cognitive symptoms, whereas a majority of time you actually have monotherapy where you only have the patient will only have one drug at a particular time. Moving on to drugs that actually target non-cognitive symptoms. And these are drugs that mainly target the behavioral and psychological symptoms that are very characteristic in dementia that we actually saw earlier when we were discussing the signs and symptoms. Orexin receptor antagonists, they actually help with the treatment of sleep disturbances or insomnia that is, again, very characteristic for Alzheimer's. And atypical antipsychotics are also used to treat the agitation that is usually characteristic in Alzheimer's disease. So moving on, so how does this all really link to National Alzheimer's Place? How does it link back to the organization that you're going to be volunteering with? And that's actually because our main aim is to reduce the rate of cognitive decline in some of these dementia patients. And a study actually showed that the risk of developing dementia over 9 years was actually 27% higher among those that were socially isolated adults compared with those that were not socially isolated, which essentially means that by reducing some of the social isolation, by volunteering with with the buddies at nursing homes that can be a lot of times very socially isolating, we might be able to actually reduce the rate of cognitive decline that is the cognitive decline that is seen in dementia patients, especially Alzheimer's. So that's the main goal of the organization, and that's something you'll actually learn a lot more about in the future modules as well. So to end it off, there will be a short quiz at the end of the module, and you can find it right below the video. And make sure you keep the link for the video as you will have to submit it after you watch and complete all the modules. But thank you for watching, and moving on, you can move on to the next module, which is the behavioral module. Thank you.